Hello, this is Susan Knowles from Cochise College Nursing, and welcome to this podcast where we'll be talking about oral medications. These are the objectives for the whole unit on oral medications. In the podcast, we're going to talk about forms of oral medications. In your chapters and modules, you'll be looking actually at labels so that you can do your calculations. Remember that you can use whatever means of calculation that you prefer, whether it be ratio and proportion, the formula method, or dimensional analysis, or you can use my hybrid method. And then again, as we spoke about in class, try to think ahead what might be about the correct answer so that you know when you've done your calculation that you're in the right place. Some key points about oral medications is that they're the cheapest usually, and they're fairly easy to administer. We need to remember that they come in several different ways, whether they be in solid or liquid, and they can be unit dosed or bulk packaged, which is usually the way that oral medications come. So it's important to remember that you're going to have to pour a portion of the oral medication out for the patient to take. And usually the calculations are fairly simple. It's really, really important that you do not break or cut an unscored tablet because you may be giving the wrong dose. On this slide, you can see different forms of tablets or capsules or caplets. So basically, tablets are powdered medications molded into shapes, and you can see that there are several different shapes, and I'm sure you're aware of those. The important thing for us to know as nurses is that the tablets that are scored, or ones that have a line running through them, can be cut with a pill cutter. Most tablets are only scored in half, but there are some that are scored in both directions, and in that case you could deliver 1/2 or 1/4 of a tablet. There are other tablets that are enteric coated or have a film over them so that they will not be broken down in the stomach but in the intestines instead. It's important to remember that you can never crush an enteric coated tablet because it defeats the purpose. There are also sublingual tablets which have to be placed under the tongue, and last week we talked briefly about the different ways to deliver medications. A buccal tablet placed between the gum and the cheek that will be dissolved, and you never swallow a sublingual or a buccal tablet because again that prevents the desired effect. There are also layered tablets which have 2 different kinds of medications as a part of that one tablet. And then of course we also have those chewable tablets, and those tablets of course are meant to be chewed before that they're swallowed. It's really confusing because so many medications or medication companies, drug companies, label their medications that are extended release differently from SA to LA, long acting, to extended release that's abbreviated as XL or ER or SR. So it's really important that you understand that all of those abbreviations mean that the tablet is an extended release tablet so that it's released over time rather than immediately. And again, that's one of those nevers that goes in the never box. Never crush, chew, or break those kinds of tablets. Capsules are the ones that can contain either a liquid or a powder, and sometimes the liquid can actually be an oil, as in like a vitamin E or fish oil. Those kinds of capsules have an oil. Also, there's a blood pressure medication that it's got an oil in it, and it has been known to stick a hole in that and to deliver that medication sublingually, but that's not the correct way for that medication to be given. So again, you can never crush, chew, or break without consulting pharmacists. There are other medications called troches or lozenges. I'm not familiar with these other type of ones that are listed on your slide, but there are, except for sprinkles, there are different kinds of ways to deliver oral medications. Sometimes these forms are actually made in a compounding pharmacy for different kinds of medications, rather than the ones that you'll see created by pharmaceutical companies. This slide is just so that you can see what a pill cutter looks like. The blue thing over there is a pill cutter, and then just another example of a scored tablet. Again, these are some pictures that come from your textbook, which demonstrate both the delivery of a medication sublingually as well as buccally, and the other one is just a layered tablet. So here's a little case study. Mrs. Garcia is a 67-year-old female who was admitted at 19:30, which we now know is 7:30 p.m., to the hospital with a gangrenous toe and heel of the left foot. She has dysphagia, which means trouble swallowing, and she has left-sided weakness because she had a stroke, or CVA, last year. She is receiving enteral feedings and medications through a PEG tube, which is directly into the either the stomach or the intestines. And she has a Foley catheter, a urinary catheter. She is to have enteral feedings held after midnight because she's scheduled for surgery of a left below the knee amputation in the morning at 8:30. So you receive the following doctor's order to continue her home medications, and you review the medication reconciliation form. The question is, what problem can you detect given the patient's history? Now, the first medication is a blood pressure medication that I often have a hard time pronouncing, metoprolol, ER, 50 milligrams PO daily, which means by mouth every day. She has lisinopril, 5 milligrams PO daily. She has HCTZ, which was hydrochlorothiazide, 12.5 milligrams PO daily. She has Lasix, 20 milligrams PO BID. She has, which is 2 times a day. She has glyburide, 5 milligrams PO daily. She has Wellbutrin XL, 300 milligrams PO daily. And she has Percocet, 325, which is 5 milligrams of the opioid and 325 milligrams of the Tylenol in a tablet every 3 hours, as needed, PRN, for pain. So what's the problem with these medications? Well, here's the answer. The answer is she has 2 long-acting or sustained release medications that she is to receive, and she also is to have her medications delivered through her PEG tube. So you're never to crush those tablets. So the answer is those two medications, and you have to alert the physician, and he has to change the order to another medication because of the delivery method that those medications are to be given. This is really a good example of a nursing type test question where you look at it, you go, I haven't a clue what this question is really asking me. You can see that you have to think so-called out of the orange box to try to figure out what is it that the question's asking for. It's just important to remember that when you're converting medication from one system to another, there can be discrepancies, so you have to be very careful about your conversions. Capsules are only to be administered whole. You don't crush those or break those. Tablets are available in different strengths, so you need to choose the least number of tablets or capsules without dividing them that you can give to a patient. So when you're calculating your dosages, you need to think about what different dosages does this medication come in so that I can deliver the appropriate dose with the fewest number of tablets or capsules. More key points. It's safer to give the whole tablet rather than to cut tablets. And the number of tablets that you should administer, or not any more than, are 3. And there are some exceptions, But when you are doing your own calculations on any of the practice problems, if you come up with some amount like 6 tablets that you have to give to a patient, you need to rethink your answer and be sure that you've done your calculations properly. So remember, the golden rule is generally no more than 3 tablets of a particular medication in order to deliver the correct dosage. There are some measures, such as milliequivalents and units, that you would use for heparin or with insulin that do not convert to the metric system. So what this example is giving you here on the slide is to determine the number of tablets that you would need over the period of the number of days. You multiply the doses per day by the number of days that you're trying to calculate. And the real life application to this, an example would be when someone is on home care and you are the nurse going to the home and you need to check the patient's medications to make sure that they have the correct medications and that they have the appropriate amount. And if they didn't, you would then take the next step, which is perhaps call the physician, get another order, whatever you think is the appropriate thing to do. So here are some examples on how you can go about calculating that. For me personally, the way that I would do it is I would look at what is the ordered dose, what is the strength that the tablets come in, and then I would multiply that by the number of doses in one day, and then I would multiply that by the number of days that I'm trying to calculate. And so for that method, it would be number 1 for me, 5 milligrams, and I need 2 tablets per dose. I need 4 doses in one day. So I know that I need to have 8 tablets times 7, which comes up to 56 tablets for 1 week. It's time for us to go to the drug machine. We call it a Pyxis or an Omnicell, to take the medications out for Mrs. Garcia for her 2100 medications or 9 p.m. at night. And she's also asking for a pain pill, and she says that she rates her pain at 7 out of 10 on a 10-point scale. And she's having pain. This abbreviation is left lower extremity. So what will you get for her? Looking at the medications that are on here, you need to pick the ones that are due at 9 p.m. And so if you were to pick those, it looks to me like we would pick a Lasix at 2100, a Wellbutrin at 2100, and it says that she needs Wellbutrin 300 milligrams and is available in 150 milligrams, so I need 2 Wellbutrin, I need 1 Lasix, and then her pain medication was last given at 5 o'clock, so 5 to 6, 6 to 7, 7 to 8, 8 to 9. She's due for her pain medication, so she can have only 1 tablet. So I would get a Percocet for her. So once again, I would get 1 Lasix, 2 Wellbutrin, and 1 Percocet. And let's see what the answer is. And it looks like I figured out the right answer. And that's what you would do. So here in this question, it's saying that the physician wants to know how many tablets of Percocet Mrs. Garcia typically takes in 1 week. And Mrs. Garcia and her daughter report that she has been taking consistently 1 tablet of Percocet every 6 hours. So what will you tell the physician? And I'll leave that for you. So let's recap a little bit about oral medications. For a client that has difficulty swallowing, or one that has a nasal gastric tube, or a tube that goes into the jejunum or the stomach as a gastroscopy tube, or for infants or young children, they then would be ordered either elixirs, which tend to be stronger, medications that are dissolved in alcohol and water, a suspension, which is dissolved in water, comes in a powder, you add water, you shake it up, or a syrup, which is something that is dissolved in syrup and water, sugar and water. It's important to remember that these are oral only medications and you never give them intravenously. I did bring into the classroom the little plastic cup where you can see here that this one is 30 mLs, which is equal to 1 ounce. And it's a demonstration of how you're to measure the amount of liquid that's actually in the plastic cup. So you want to look at the meniscus, which is that curve, to see where it is, the little markings on the plastic cup. And the way to do this is you have to sit it on a flat counter, and you have to be able to have enough light so you can actually see that you have the correct dose in there. I would tell you that if this dose needs to be super, super accurate, you would want to use a syringe, and you can still take the syringe and put the medication in a plastic cup if the patient can drink it out of the cup, or you're really careful about making sure that you've got the liquid at the right line. The other dispensing apparatus here on the slide is a dropper. This is pretty self-explanatory. You just want to fill the dropper up to the appropriate dosage on the dropper. It's really important that you do not confuse the dosage strength with the total volume that's contained in a container when you're reading a label. And this will become even more important when you start studying reconstituting medications. So you're reconstituting a powder into a liquid. So it's important, again, to read the label carefully, because the container may have 100 mLs or milliliters in it, but the strength may be 125 milligrams per every 5 milliliters. And medication errors often occur with oral medications because they are the least likely ones to be delivered in a unit dose. And so oftentimes you will have to take it out of a bulk bottle where it contains 100 mLs, as I gave you an example, but you only need 5 mLs or 10 mLs out of it. Now there are oral medications that come in little plastic cups with a foil lid on the top of it that's already pre-measured for you, but that's not always the ordered dose. So you may have to recalculate the dose and only take a portion out of a unit dosed liquid medication. Now here's another situation with Mrs. Garcia. It's 3:30 in the morning, and an aide on the unit notifies you that Mrs. Garcia's oral temperature is 101.6. You review the chart and find the following order. The patient can have Tylenol Elixir, 400 milligrams every 4 hours as needed for fever if it's greater than 100 degrees Fahrenheit, not to exceed 2,500 milligrams daily. The available dosage is Tylenol Elixir 160 milligrams per 5 mLs. So you need to figure out how many milliliters that you will administer to the patient to equal the dose that you need, and then what device will you use to measure the dosage. This is the type of question that you will find on your exams that I make for you. So this is a very important question, and these are the type of practice questions you ought to be reading and practicing so that you feel more comfortable with understanding what it is exactly that you're supposed to be calculating. The answer to this question is 12.5 milliliters that you measure in a plastic medicine cup. You can also use a syringe if you feel more comfortable. And you say, well, the syringes only hold 5 or 10 milliliters. There are bigger ones, but we generally don't use bigger ones to measure medications. Well, what you can do is you can pull back 10 mLs and put it into a plastic cup, and then you can pull out 2.5 mLs and put that in the plastic cup, and you can still give it to the patient so that the patient can drink it. But the alert on this medication is about the Tylenol, the acetaminophen, because it can cause liver damage. You do not want to overdose the patient on Tylenol. And you think, well, a Tylenol is an over-the-counter medication and people can take it all the time. And that's true. And people oftentimes will do an overdose with Tylenol and find that they may not die, but they are now faced with liver disease. So we as nursing need to be very careful to not overdose our patient with Tylenol, what we may think of as a seemingly safe medication.